Welcome to Dr. Abayomi Ajayi Live. My name is Dr. Abayomi Ajayi. Today we are discussing how you can still be a father even with zero sperm. Well, let me start by saying that this I consider a very serious topic. Serious in the sense that there are a lot of young men now that are walking about with zero sperm. And I don't even understand that, because this, for me, I think it should be a public health concern now. The incidence of zero sperm in men is becoming alarming. As we go along in this program, we talk about some figures, but why we are a little bit cautious is that we are saying that these are not population, wide-based population studies. These are studies that are done in our centers, and we also, we have 3 centers in 3 different parts of Nigeria. We also have been able to compare even sperm count in the different areas, and there is a lot of disparity in it. So we know what infertility means. For the sake of the discussion, infertility is the inability of a couple to conceive after 1 year. And we say that it's not a life sentence, because it does not mean that you can't have children, but it might just mean that you need help. Now, we know that 25 to 30% of couples in Nigeria face or have to face this infertility at one point or the other. Don't forget the definition, is that they are not able to have a child after 1 year of trying. And we also know that about 50% of the cases of infertility are due to male factor. But I'm beginning to believe that this is actually even underreported. It's likely even to be higher. And I'll tell you why I think so. In Nordica, we pay a lot of attention to male factor infertility, because one neglected part of infertility. Women are supposed to get pregnant, so everybody is always facing the women. But we know that men contribute at least equally to, before you see the bump in the woman, the male factor contributes at least 50%. And we looked at about 900 sperm samples, and what we saw was alarming. We saw that out of every 2 sperm samples, 1 would be abnormal. So 50% of the samples are below par. Out of these, 12% no sperm count at all. So 38% low sperm count. And we also saw some things. Maybe before I go on, please like and share this video on your timeline so many people can also benefit from this. We also saw some factors that are contributing to both no sperm and low sperm count. And obesity was number 1. Men who are obese. And that's why I get alarmed, because we see a lot of young boys now that are obese, some even morbidly obese. And we have seen that about obese men are at least 1.5 times to 2.5 times more likely not to have sperm count. The other factor that we saw was age in men. So this thing that we say is only women that are affected by age is not true. After age 45, it becomes very difficult, more difficult for men to even impregnate their young wives. So it's an ongoing process. I think by now, the next review we are going to be looking at about 2,000 sperm samples to be able to see, is there a consistency, is there a uniform pattern in this thing. But what we are seeing, shooting from my hips, really and truly, is alarming. And I think we should pay attention to some of these things that we're going to discuss today before we go to how to manage when you don't have any zero sperm, or when you don't have any sperm count at all. When we want to, the bad thing about this is that usually there are no symptoms when the male factor is involved. And that's what makes it even more perplexing. And people tend to confuse virility and fertility. Virility means that, oh, you can get it up, you can have an erection, and you can have intercourse. It's quite different from you being able to impregnate your partner, because some men even have to use drugs in order to overperform, and some of these drugs actually affect their sperm count. So it's a thing that we really need to, yes, Grace Inyamuwa Omo, Kosh Milayo, Modin Olachi, Joke, Ashubiaro, Omezi Chooks. Thanks for joining on Facebook. On Instagram, Alabioluwada Messi, Eyin Jume, Joe Adu Debanke Eniola. Thanks for being on with us on Instagram. So, like I was saying, that the problem most of the time is that there are no symptoms, and it is only when the deed has been done, when you have been trying to impregnate your wife and it's not happening, that's when you now come, and then we now make a diagnosis and see that sperm count is either low or it is not even there at all. Sometimes there can be some symptoms. There can be symptoms, there can be problem with sexual function. Either there is difficulty with ejaculation or small volume is ejaculated. That might just be the pointer, the only pointer that you have. Some men find it difficult to ejaculate, or when they ejaculate, they just ejaculate just a tiny bit. Because sometimes this might mean that you are ejaculating in the wrong place, what we call retrograde ejaculation. So what I'm saying, some of these symptoms is that if you notice them, so that you can go to your doctor and see what can be done before even you start looking for how to impregnate your wife. Sometimes some men will have reduced sexual desire. I'm a little bit careful when I talk about this, because of course there is a lot of myth surrounding sex, especially in this part of the world. I hear people 5 rounds, 6 rounds, as if it's boxing. But most of the time it's not true. Okay, we're talking about people who can't even have sexual, they can't even have an erection and perform their conjugal duties. That's what we're talking about here. Or there is difficulty in maintaining an erection, which we call erectile dysfunction. Or there's a pain, or there's a swelling, or there's pain, or there's swelling or lump in the scrotal area. These are things that are pointers for you to see a doctor, whether you have started trying for a child or you're not started trying for a child. There are pointers that might make you to see a doctor quickly. Or some men also they've developed abnormal breast growth like women. That is also a pointer for you to see the doctor. And for some men is that they cannot smell. They just can't perceive any odor at all. That sometimes also is a pointer that there's something going on that you need to see the doctor for, even probably before you start trying to get your wife pregnant. If you are not married yet, there are things that can make you to see the doctor before even you start trying. Now, because when we take it very likely that it's just when you want to get your partner pregnant that we take it for granted. But there's a lot of things involved for a man to be able to get his partner pregnant. For that to happen, you must produce healthy sperm. That means your puberty must have been normal growth and formation of your reproductive organs during puberty, and that at least one of the testicles must be functioning normally. Your body must produce enough hormones to trigger and maintain sperm production. And then the sperm also has to be carried into the semen through some delicate tubes, which sometimes can get blocked along the line. And there needs to be enough sperm in the semen. Now we say 15 million per mil. That's what the World Health Organization has recognized as adequate sperm. 15 million per mil. Or we say there is 39 million in the ejaculate. And the semen must be functional and be able to move. And those are some of the things that we look for when we're trying to assess the male function. So now, when we now want to see when there's a problem, we can categorize them and say, okay, when there is low sperm production, usually this could be inherited, it could be genetic, or there can be an abnormal sperm function which can come from age. It can be inherited and can come from infection. So there can be blockage to the delicate tubes, like I said, that can transfer the sperm into the semen, and this can also be genetic, and this can also come from infection. Then some illnesses can also lead to deranged sperm count. cancer sometimes is one of these, and that's why when a man has a swelling in his testicles, his scrotal area, let's say, he should see a doctor, because sometimes that might just be the first sign that something is going on. And early diagnosis is always very important. And then, of course, sickle cell disease might be one of those things again. Sicklers tend to have low sperm count. And then maybe also injuries, playing football at school, or falling into a manhole, stuff like that can also lead to either low sperm count or no sperm count at all. But the one, if you notice, most of the things that I've been saying, they are not things that are really in your control. But one big factor is in your control, and that is lifestyle. And that, we think, is a major player in what we're seeing now. You know, like I said the other time, we've seen that in Nigeria, what we saw is that obesity is the number one factor that goes with, I'm not saying causes, but that goes with both low sperm count and even zero sperm count. So maintaining a healthy body weight is important even for men. So what you eat is important. A little bit of exercise is good, you can't go wrong with it. Then alcohol, man, sometimes I see the way I see how people take alcohol these days. We really need to be very careful, because these are things that can jeopardize our future, at least from the point of view of reproduction. Not to talk of illicit drugs. Marijuana, today I was listening that they said in London they consume 23 kilograms of cocaine daily. In one city, they're consuming 23 kilograms of cocaine. That's what you travel with. They allow, what airlines allow you to carry. That's what on a daily basis is being consumed. So there's an epidemic of drug usage and everything, and all these things are coming to bear on male factor. Now, and we see a lot of people, even in Nigeria, that are on drugs coming for treatment. It's not only men, but we're talking about men today. And also, now the question is, if you tell me that there might be no symptoms, how can the diagnosis of male factor, how can I know that I don't even, whether my sperm count is low or is no? And the answer is that the only way to find out about male factor is to do a seminal fluid analysis. Okay, you must take your sperm sample to a laboratory where they look at some characteristics in the sperm. Now, but here we also need to be very careful. This is just a rough test. It's the best we got now, but this test we are beginning to see can be sometimes not very reliable, but in the sense that up to about 40% of men who have infertility have been given a clean bill from doing seminal fluid analysis. So it's not a very sensitive test. So, but we still, that's the best we got for now. Please like and share this video on your timeline. I'm saying that again. So, excuse me. But there's some things you need to do in order for you to prepare if you want to do this sperm test. You need to abstain for not less than 2 days, but definitely not more than 5 days. You know, so you don't ejaculate in any form. Because sometimes we say don't have intercourse, and some people are doing masturbation. It's no work done also. No ejaculation of any form between 24 to 72 hours before you do this test. Then we also say you avoid alcohol, caffeine, and drugs, even if you are on marijuana or cocaine. You need to avoid this because they will definitely affect your test. At least 2 to 5 days. Another one that you need to avoid are these herbal medications. You know, there's a lot of things going on now. I hear all kinds of names. I'm not going to mention any name. I hear all kinds of herbal preparations for male factor infertility. I'm sorry to disappoint you, but these things are not proven. So, and when you want to stop herbal preparation, whether it is local concoction, whether it is produced in capsule, you know, you have to stop them. You know, every tribe has whatever they use, but seriously, these things are not proven to work for male factor infertility. So please stop them before you do your test. And then when it's better that the sample you are going to give us is produced by masturbation. But for some people, if you cannot masturbate, then you might need to interrupt intercourse to produce. But the thing again is that if you're doing the test in an IVF center, most of them will have a place where you can produce the sperm sample. But if you are in your lab, if you're going to the local lab, then you need to make sure that the sperm sample gets to them within 30 minutes of your production for the test to be meaningful. Now, we have seen how diagnosis can be made. Now, once that you have been diagnosed of having no sperm count, that's where we are really going today. Now, I must say that this is not in any way a light diagnosis. It's not something that we just say and then walk away. Because anybody that is told that he has no sperm sample, what comes first to your head, especially in this part of the world where we place a lot of premium on childbearing and child rearing, is my life is finished. What am I living for? That's what you hear some men say. But tell you what, that's why we have this program today. It's not the end of the road. Okay, it's difficult, but it's not the end of the road. But there are other things that I even want us to be able to take advantage of. You know, in Nigeria, even when we have the technology of IVF and everything, most of the time we are only focused on the hardware. The software, we still miss it. What do I mean by software? The psychological support, the emotional support of everything. It's usually said that men are neglected in the infertility journey, but we think that should come to an end. It should stop. Most especially when even the man is the one that is affected or the cause of the infertility. Then you need help. And what I'm going to do after this program, or you go to my Facebook page before the end of the week, we're going to start a helpline for people, men who have issues with fertility. Now, we're going to have a Facebook page for them. It's going to be only a closed group, and we're going to have two professionals administering it, and then over time we're going to choose one of the people who participate very well to be an administrator, so that we can have a balanced group. Now, on this group, we do not want men talking about I'm doing 5 rounds, I'm doing 6 rounds. We want very serious issues. Men who have been diagnosed with infertility, men who are having problems with their marriages, men who want to be helped. It's not, so please, you just go to my Facebook page. Before the week runs out, you get more information on this group. But why do we think this is so important? Because, like I said, it's a very important and it's a very serious diagnosis. Now, when you go to your doctor, the doctor is going to try to look for the reason why this is so. So he's going to take your history, try to elicit some of these things that were spoken about. He's probably going to do a physical examination, try to see breast development, try to see the testicles, to see what the size is, and then he's probably going to do a testicular scan. He might ask also for a hormone assay in order for him to see what your hormones are like. Sometimes the test of the hormone assay might point out that there needs to be some genetic testing, and they can ask for them. And then for some, there are different kinds of genetic testing that can be done. It's the one that you do for testicular failure might be different from when you see that some of the tubes are blocked. Then the doctor will try to exclude retrograde ejaculation. I told you the other time, when you are ejaculating into the wrong place. So instead of the ejaculate, that's the sperm, coming to the vagina, is going to the bladder. And there are ways to treat that also. But by and large, if we see there is no retrograde ejaculation, and what we have is what we call azoospermia or no sperm count, then there are 2 types of this no sperm count. Don't forget, the sperm is produced in the testicles, like I said, it has to be transported to the semen, and then it's before it comes out. So if there is blockage along this line, we call it obstructive azoospermia. So in obstructive azoospermia, the factory or the testicles, they're still working. It's just that there is obstruction to the line where this sperm is supposed to take. And this can come from either infection, can even come from a previous surgery. For some people who did angiography as youngsters, they were done in villages, and the doctor was not particularly very experienced. People have tied that tube in the process of doing the angiography. But yeah, so you can have your testes are working. In the second type, which we call the non-obstructive azoospermia, the testes are not working. Actually, that's what we call testicular failure. Okay. Therefore, it is possible, even in the non-obstructive, where there is testicular failure, to be able to get sperm from the testes. It is more likely with the obstructive azoospermia because the testes are still working. So sperm is being produced. It's just not getting to where it's supposed to get to. But even in non-obstructive, because the testis just doesn't die in one go. So it's possible that some part of the testis is still working. So sometimes we can get sperm from this, but of course you know that the longer it stays, the longer the condition is, the less the likelihood of us getting sperm from the testicles. So once we do this with doing testicular aspiration. It's a very minor surgery, and there are so many modifications of this surgery. The only thing is that whenever that is done, it also means that you cannot but do IVF, because the sperm that can be gotten from the testicles are not matured, so they can't swim, they cannot fertilize the egg on their own. So we need to use a form of IVF that we call ICSI. So that way, many people with zero sperm count have been able to father children. But like I said, it is the first thing we need to do is to be able to see, do we still have sperm in the testicles? If it is there, even if you are not even ready for treatment, we can stop and then use for later. Now, I want to talk a little bit about drugs, because I see a lot of people, a lot of doctors prescribing drugs for people with no sperm count. These drugs range from bromine to HCG, and they are on these drugs like forever. I must tell you, this is like hoping against hope most of the time. Only about 5% of men will respond to this, and you can see the people that will respond from their hormonal pattern. So it is only this kind of people that can respond to it, and there are not many. So majority of the other people are going to benefit from what I said before. Now, for some people also have all kinds of drugs, including testosterone. They have all kinds and all its derivatives. I'm sorry to disappoint you, but they do not work in this instance. So please, when you have azoospermia, it is not the end of the road, but you must be doing the right thing. And then, of course, sometimes when we have done everything and it has not worked, use of sperm donors is also something to consider. Now, anytime we talk about donors, especially sperm, men, the first reaction of men is to cringe. And also we've had men who even have, because they've not been prepared well enough before they took that decision, that their initial reaction to the child is that they reject. Though sometimes after a while they come back to especially when they're helped. But it's always important for men to allow themselves to go through counseling, especially when they are making decisions that they might have to think about later on in life. Actually, for you to make any decision in assisted reproduction, you need counseling. But you know, in Nigeria, many people just think counseling is for weak people. I continue to say that everybody needs counseling. Everybody, even pastors need counseling. I'm sorry to say that. Every counselor needs a counselor. That's what I mean. So the fact that you are even counseling people, because that's what I hear some people, they say, you want me? Who is going to counsel me? I counsel people in church. Sorry. When you're faced with such a problem, you need someone to talk to. And so this we cannot complete this without talking about prevention. If we say all these things are they're like an epidemic, that there is a public health concern, then if we don't talk about the prevention of male factor infertility, then we're not doing justice to the people who are listening to this. So when we talk about prevention, the first thing is the way our young men are using alcohol and these energy drinks should go down. We need to reduce it. These things contain a lot of caffeine, the energy drinks. And I see the way they mix with NSC and make all kinds of concoctions. Sorry, this is not good for your health. And I sound old school. Trust me, I've been there too. So I know what I'm talking about. So you need your body, you're not going to find spare parts for your body. So it is now you need to start making very responsible decisions. You know, some of them I even see that are as slim as like this, and they take Hennessy, take vodka, and then put. Come on, and you know what? Even the ladies are not any. They're not any better these days. So we're heading for a problem with fertility, and we cannot stop talking about this. So you have to limit or abstain from alcohol. You are smoking. It's a no-no, unfortunately, because smoking is injurious to your reproductive system. I'm sure everybody knows that. But now also, cocaine, marijuana, they have very devastating effect on your reproductive system. And we see, I've seen patients that the only thing they did between treatment is just stop smoking. A particular patient I will never forget, she did the first treatment, egg production was bad, and then the mom now came and said, did she tell you that she was smoking? Because we asked her and she said she wasn't smoking. Did she tell you that she smokes? I said, no, she didn't. But we asked her and she said no. And the mom says, look, she smokes about 10 sticks in a day. And so we took it up as a project and we're on it. And throughout the time that she repeated the cycle, she stopped smoking. And it was like, it was a different person who did the treatment. Good eggs were produced and she succeeded with her treatment. So we need to look at some of these things. We need to avoid things that lead to prolonged heat to the testicles. From the underwear you put on, they should be cotton underwear, to putting phone in your pocket, there are things that you need to avoid. To putting laptop on your laps, there are things you need to avoid. And then you need to reduce stress. I don't know, that's in Lagos, that's a little bit tough, but you will have to put conscious effort into it. And there are ways to reduce stress now. We all know that we're all stressed, especially if you live in cities. But there are ways that you can reduce stress now. If you like, you can do yoga. If you like, you can do acupuncture. You know, all these things help. And breathing exercises also help. So, if you, of course, you know that you need to avoid exposure to pesticides, heavy metals like in paint industries, like in petrochemical. Oh, that's another thing that we're seeing. Just like I said, we did a study comparing our three locations, Lagos, Asaba, and Abuja. And I can tell you for free, results are poorer from Asaba for sperm. So we know that definitely there's a linkage between petrochemicals and sperm count. So please, it's on this note that I'm going to end this week. Please send your questions to info@abayomiajayi.com.ng. I'll say that again, info@abayomiajayi.com.ng. And please be on the lookout for especially this will be only for men, the closed group that we're going to form on Facebook. And like I said, I want volunteers, if anybody wants to volunteer to be an administrator, all well and good, or we can wait until we see people who are actually active in the group and make one of them the administrator. But definitely we are going to put 2 professionals as admin from our own end. So it's on this point I'm going to end this week. I'll see you in 2 weeks' time. Stay healthy.